Everyone's heard of breast cancer, but how much do we really understand? What are the warning signs beyond the lump? Who's at risk? And why do so many cases go undetected until it's too late? Why is fear still stronger than facts in so many homes? How does culture, cost, and silence shape the way breast cancer is experienced? In this episode of Untangle, we're asking the hard questions about breast cancer, questions that could change how we talk about it and maybe even save lives. Let's untangle it. I am Amadine Ubewe. Welcome back. I have been joined in the studio now by a medical doctor, an expert, talking about Dr. Nguper Dooyum-Laha. She is the medical officer at Medicaid Cancer Foundation. Welcome to the program. It's good to have you.
Thank you so much for having me.
Thank you so much for coming. All right, so let's start from the basics. Our program, we want to simplify it as much as possible. What is breast cancer and how does it develop?
Okay, breast cancer is an abnormal growth of cells in the breast. The breast is a gland found in anatomically female persons, and it has different parts. So different stressors or mutations could lead to unregulated growth from any part of the breast, and this is what is a cancer. And how it develops, as I said, it could be, there's not one cause that can be pinpointed. It's a multifactorial disease. In 10% of cases, in about 10% of cases, it's genetic. And the other cases, it's as a result of their lifestyle, or it's due to risk factors which we say are modifiable and unmodifiable. For example, being female is not something anyone can change, okay? You were born female, so that puts you at risk of having breast cancer. Having a mother or a sister who had breast cancer is not modifiable. That increases your risk as well of getting breast cancer. But things that can be changed now are, for example, smoking, alcohol, a sedentary lifestyle where someone is obese and does not exercise. For example, that also increases one's risk of breast cancer. And then something else that is not modifiable is how early ladies start their menstruation. Exactly. If it's too early, that increases your risk of breast cancer. And then modifiable again, we have the use of hormones. For example, the oral contraceptive pill, for example, and then in older ladies when they reach menopause and they use hormone therapy, for example, that could also increase their risk for having breast cancer. So there are a variety of causes, and research still discovers more every now and then.
Well, that's really interesting, especially for those who were not aware of the genetic or that is hereditary, basically, right?
Yes.
But is it a certain thing that if your mother had, then you will, or it just increases your chances?
It just increases your chances, like I said. So if someone's mom had or sister had it, there is a gene in the body called BRCA1 and 2. If so, you might need to check for that gene. If you're positive for it, then it increases your chances of having breast cancer. Now, if someone knows that their mom had breast cancer and they start to live a healthy life, they exercise, they stay away from smoke, they stay away from alcohol, they could get breast cancer still. It's protective now. Exercise is protective, but they could still get breast cancer. But as a result of living a healthy lifestyle, you may not die from breast cancer. I just want to point out one thing. For example, the Caucasian race, that's white. The white woman is actually they have a higher incidence of breast cancer. So they have more breast cancer cases than black women. But black women are more likely to die from breast cancer. So it's you can get it and survive, and you can get it and not survive, depending on the lifestyle you live.
Indeed, it's a chilling fact that you just shared.
Yes.
But maybe I want to jump the gun a bit now, because so far we've said women. There is a conception, maybe you can correct it or debunk it now, that even men get breast cancer.
That's right. That's 1% of all breast cancer cases are found in men. And guess what? Black men are more likely to get breast cancer. So there is a chance, because men also have breast tissue. Okay, so as long as anyone has breast tissue, but women have it more, so they're more predisposed to that.
All right, fair enough. What would you say are early signs that women, let me say people, but anyway, we know it's mostly about women, that they can look out for in terms of protecting themselves and being ready, preventive measures and all of that?
Okay, so the breast, examining the breast. So that's why we advocate for women to always self-examine themselves. And at any point in time, if they notice a lump or a mass that has never been there, if they notice any changes in the skin of the breast, for example, redness or a dimpling, suddenly you notice that it's no longer as smooth as it was, or it becomes, or you notice a difference in the size. Another symptom could be discharge that isn't milk. So someone suddenly notices that they're bringing out fluid from their breast, and also pain. Yeah, it's not so common, but it can exist. And when we teach women to examine their breasts, we teach them to examine all the way to the supraclavicular region and the region, the axillary, which is like the armpit. So if you feel any masses like lymph nodes or something there, it's still an alarm. Present to a doctor and get properly examined.
Nice.
And then some cases do not show symptoms. That's why we say from the age people to present for mammograms, because the mammograms can pick the smaller ones that cannot be felt by the hand.
So you were saying what age? Oh.
From the age of 40. Yes, from the age of 40. It can be 35 if your mom or sister had it earlier than 50. Yes, you can present.
What you just said raises a question for me now. If you're saying around 35 to 40 is the time to begin mammograms, does it mean, generally speaking, younger women are not, do not experience this? Because one would have expected maybe a much smaller age to say, okay, start checking all the way up so that in case, but to put it at 40, 35, does it mean is the older you get that it becomes more likely?
The average age is 62.
Wow.
So that's like plus or minus. So it's more likely to be found in postmenopausal women. But in the past 3-4 years, we've been seeing younger women presenting with breast cancer as young as 25. So everyone from the age of 25, everyone should get used to checking their breasts regularly.
All right, that's fair enough. In the issue of, or in the note of clearing misconceptions and all of that, there is a belief that wearing bras and using deodorants is something that increases your chances. Is there any truth to that?
Yes, that's a myth, because studies have been carried out, and so far we found no correlation, no evidence backing that claim up. So no, that doesn't cause breast cancer.
All right. You mentioned a mammogram. Maybe you might want to simplify that for understanding. And then there is mammogram, ultrasound, and biopsy we hear. What's the difference? And are these all related to breast cancer?
Yes. So the mammogram is X-ray, basically. It's an X-ray done for the breast. It can be in 2D or 3D. And the advantage of this is that it's able to pick up smaller masses, as I mentioned before, that might not be able to felt by self-examination. So it's really a good screening tool. And then the ultrasound, it uses ultrasound waves instead. When you present to the doctor, they place some gel on your body and they use a probe based on on how blood is flowing through. They're able to see the image on the screen, and that can detect all sorts of masses. And the added advantage is that it can also see lymph nodes, for example. And after the mammogram and the ultrasound, if they find anything, they go ahead and book you for a biopsy. A biopsy means that the doctor goes in, they take a needle, they take a piece of that lump or mass that was felt or seen on the investigation, and they test it to be sure, is this breast cancer? Is this not breast cancer? And if it's breast cancer, they go ahead to check what kind of breast cancer it is.
I think that perfectly leads to the next question. What are the types of breast cancers?
Okay, so like I mentioned earlier, the breast is a gland. Okay, it has fatty tissue, it has ducts in which the milk is stored, it has lobules which separate the ducts. So growth of cells from any part of this region, if it develops, if there's abnormal growth in the lobules, then it's a lobular breast cancer. If it's in the ducts, then it's a ductal. But then there's also a kind of breast cancer known as Paget's, which it just starts from the skin, okay? And that is the one that appears as dimpling of the skin, like an orange skin. It appears something like that. And then, so that's in the morphology. By morphology, I mean what you can see under the microscope. Then there is the breast cancer that is due to hormones. We call that hormone receptor positive breast cancers, estrogen or progesterone. And then we have the HER2 breast cancers, which is a protein found in the breast. And then we have the triple positive breast cancers, meaning that if you take that biopsy and you test for it, you will find both the hormone, you will find the HER2, and there's the negative as well, in which you don't find any hormones, whether PR, that's progesterone, or estrogen, and you don't find HER2. Those are a little bit more aggressive and more difficult to treat than.
Does that mean basically the absence of hormones?
Yes, so it means that it wasn't exactly too much hormones that triggered it, and it wasn't the protein HER2, and they're still trying to find out how to treat it best. Yes, so the good thing about having a biopsy is that when you know if it's hormone receptor positive, they get on hormonal therapy. It determines the kind of medications they will get. If it's HER2, then they go on immunotherapy, which targets the HER2.
But I think before we get there,
yes.
let's speak about the fatality or survival rates. Are there some that are more dangerous than others? And then perhaps we can then go into treatment. What do you do if you're discovered to have any of these?
So if you're discovered to have a mass either on scan or chest x-ray or by self-examination, the next thing that your doctor needs to do is to also stage your tumor. For example, if it's less than 2 centimeters and the lymph nodes are not involved, that's stage 1. Stage 1, in people who have been discovered to have stage 1 breast cancer, more than 90% of them survive. They survive the diagnosis. So it means that it's still within the breast, it hasn't spread. Okay? By the time you're getting to stage 2, it means that it's bigger than 2 centimeters and maybe it has started to involve 1 or 2 lymph nodes. That also, you can have some chemotherapy, and it's a combination. Yes, but stage 3, for example, means it has advanced beyond the level of the breast. So maybe the muscles beyond the breast. So when the stages start going up, then chances of survival start looking grim. When it reaches stage 4, it means it has spread. And stage 5, it has spread to like other organs. For example, the lungs. The lungs, because immediately after the breast, it's the lungs. And then to some people, the bones and the abdominal cavity, the rest of the blood. So those who present at a later stage, the outcome isn't so favorable. That's why we advocate for self-examinations and regular screening.
All right, fair enough. I would still like to talk more about the treatments. So there's a particular concern that women have that we'll also point out as to what we've heard about steps that are taken to treat breast cancer. So we'll take that after the break. Don't go anywhere.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
celebrate, and preserve the arts and culture that define us. Welcome back. We're still untangling breast cancer here. Doc, let's talk about what we've seen with perhaps breast cancer survivors and people who have been patients. People see that usually they undergo a procedure where they have their breast removed. Where does that come in here?
Okay, so the treatment of breast cancer is a multi-modality treatment, means that it's not just one way. Oftentimes, patients will need chemotherapy, they will need immunotherapy, some will need radiation, some will need surgery, and then continued chemo. So surgery, usually surgery is of two types. They could either get a lumpectomy or a total mastectomy. Now, the lumpectomy means that the size of the cancer is not so big, so we can afford to just go in and take that portion that has been affected, just the lump, take the lump out, and we're good to go. But when we're looking at the size is like more than 5 cm, for example, or lymph nodes have been affected or it has spread beyond the chest, then we advocate for a total mastectomy where the breast tissue, everything concerning breast is removed, because cancer arises from breast cells. So the reasoning is that once there are no breast cells, then cancer won't come up again.
And what was the success rate for that?
Usually it's, so I can give a number, but in the country currently we have really good surgeons, and it's over 90%, that's the mastectomy. Of course, there might be complications, for example, because...
Oh, sorry to cut you short.
Yes.
I don't mean maybe the success of the surgery. I'm saying if you have the surgery and it's successful, the chances of the cancer coming back and all of that, is it still there?
So that depends on a lot of things, for example, on how aggressive the tumor is. Like I said, the triple negative, for example, we're still battling with the therapy for that because it's not so responsive. So if someone has a triple negative kind of breast cancer, it can be hard to say if the mastectomy does, especially if the cancer has already gotten into the bloodstream, it can be hard to say if it will be cured completely. And then for some people, even after complete cure, there could be a recurrence of the cancer. And that's where lifestyle also comes in. Like, patients are being told once you've gotten your diagnosis and you've kicked it, you need to maintain a healthy diet, exercise, stay away from smoking, alcohol, the things that triggered the cancer in the first place. But there's this popular Hollywood actress, Angelina Jolie.
Yeah.
Maybe you know her story. Her mom had breast cancer. So to be on the safe side, she's had a mastectomy of both breasts. So right now, you know that she won't be dealing with breast cancer in the future because she doesn't have any breast cells to contend with. But that's an example of someone who knows that, you know what, it's not about the breast, it's about living, you know?
Yeah. I just I'd like to ask something that some persons might consider just an issue of vanity, but are mastectomies usually accompanied by cosmetic surgeries, or is it that when you take them out, it just has to be that way? Because there are people who said they've gotten the procedure and you couldn't tell, you know. So I'm wondering if that's there.
So yes, at the time that they get the procedure, they're still undergoing medical therapy. So at that time, no one is worried. No one is going to urge you to get cosmetics done. But after you've beat cancer and you're healthy, yes, there's possibility for reconstructive surgery where for some people, muscle from another part of the body can be taken to reconstruct that area so that it appears as though they still have breast there. So that can be done. And for some people, they're using prosthetic breast. They feel like, I don't want to have any surgery, but I still want to look good. So they use their prosthetic bras that come in with breast, and that works for them as well. So it depends on every patient, honestly. But that's not, I won't think of it as vanity because health starts from the mind.
Indeed.
So if that's what you need to, you know, look good and go kick ass, please go ahead.
All right then. I want to take you back a little bit. When you were talking about the stages before, you were clear that at the first stage, about 90% survival rate.
Yes.
What about the rest? If you come, at those other stages, what hope do you have left?
Okay, so honestly, in our environs in Nigeria, there isn't so much research on that, mainly because we have our patients, because of lack of resources, not all of them go through all the therapies that have been prescribed. Some start and stop halfway. So based on that, it's not so, like I mentioned earlier, Black women are more likely to die from breast cancer because not all of them complete the therapy. So we do not exactly have the statistics for the different stages. But for stage 1, for sure, because that doesn't involve so many steps in the treatment. It's documented more than 90% of them survive.
Okay, before we go maybe into some more social aspects of this, let's try and get some technical knowledge now. If as a woman, it does happen that it has happened, you have the diagnosis and all of that, what's next for you? And I ask this in reference to how affordable is cancer treatment? The other day we saw the government is opening more cancer centers across the country, but an average person, say a woman who's earning minimum wage or just a little bit more, what's the hope for her? If it's not affordable, what then can she do, or where can she go?
So honestly, it's a sad reality, but I would say even the middle class, they sometimes may not be able to afford the treatment of breast cancer, depending on what it is. If it's the hormone receptor that just needs chemo, for example, they may be able to handle it. but then even radiotherapy is very expensive, and surgery. Anyone can do surgery, but sometimes you want the best where you don't have complications. We're talking about tens, millions, basically. So in Nigeria, we have the Cancer Health Fund, for example, and several other organizations that help to subsidize women in some of these treatments. So the first thing is to start, and then along the way, you look at which organizations can help. But to say it's affordable, no, it's not. For example, let me give you an example of the HER2 type of breast cancer. That person will need chemotherapy and immunotherapy. Currently, I'm not mentioning the cost of the chemo, but the immunotherapy, I think a vial of it, which is called Fesco, costs about 1.5 M.
And you need that many
Every
vials?
3 weeks.
Wow.
So that's just the first 6 cycles. And then afterwards, you have to do surgery, you have to do radiotherapy. Radiotherapy can range from 800,000 to more than 1 million. And there are not so many centers offering radiotherapy. So imagine someone in a state such as, let's say, Benue, where there is no radiotherapy center. All over the country, there are only like 6 accredited cancer centers. So sometimes even the cost of travel is discouraging, and then finding where to stay. That's why so many people are not able to follow up and complete their treatment. So it is something that government really needs to step in a bit more. There are a lot of organizations, for example, Medicaid Cancer Foundation is filling the gap in some of those things, but we need more hands on deck.
Right, fair enough. Now, let's talk about stigma or misinformation. How do you think it affects the awareness of breast cancer?
It really does. Some women feel that they're no longer a complete woman. Okay, their husband will not want to be with them anymore. For some women, there's even issues of infertility. It causes infertility. So there's a real stigma around.
But that's not true, right?
Yes,
Is it true?
no, it's not.
Okay.
What we need more of is awareness. And thankfully, we have a lot of survivors speaking up and championing this campaign. So we're getting good. It's one thing to just have a doctor come speak to you about breast cancer. It's another thing to have a woman tell you, look, I went through this thing, I beat it, I survived, and you see her, she's looking good, you know. It's encouraging. It's encouraging when you see patients, they're like, you had it too. And they're like, yes, I did. It's a whole new ball game. So I guess more survivors need to be involved in the fight against breast cancer, and not just survivors, the men as well, to start educating them that, you know what, this is not a death sentence unless you make it be. And when we don't talk about it, there will be more stigma. But the more we talk about it, the more people start to see that, you know what, this is around us. 1 in 8 women. So out of 8 women, 1 will have breast cancer. So we need more of these conversations, and I think the more we talk about it, the less the stigma will become.
All right. Are there what about cultural aspect, beliefs or taboos that contribute to these misconceptions?
For us, really, it will be the poor health-seeking behavior. That's in Nigeria, the poor health-seeking behavior of our patients. You know, many people would rather go to the herbalist or to their village people instead of presenting to the doctor. So that's not too good. And then that's just it.
All right,
I
fair
can
enough.
think of, yeah.
All right. Are there any other misconceptions that you've encountered that you would like to debunk, perhaps? It could even be from women who come to seek consultation or who have questions that they might have in their heads, or others that you would like to debunk.
Okay. Right now, we've already covered the one on deodorants and bras. Honestly, I can't think.
Okay, maybe we can take a look at this. We're talking about the breasts. Usually, I mean, naturally, people will think about breastfeeding. What do you have to say about that? And breast cancer and breastfeeding, Does anything change? What are the issues there?
Yeah, thank you so much for bringing that up. Yes, actually, it's been proven that women who breastfeed for their babies a year and longer, they have a decreased risk of getting a breast cancer. Yes, it's, the reason is because what is the breast meant to do? It's meant to release milk. Exactly. So it's like having a car and you park it for a long time. If the engine is going to pack up, do you understand? But the more you use it for what it was meant to be used for, the better it will function. So that's one theory. And another one actually is women who took long to get pregnant, for example, who have never been pregnant, have an increased chance as well of getting breast cancer for the same reasons we spoke about. Yes.
All right. I think that's understandable. Now, let's end it this way. Is there anything coming up? Any innovations? I spoke the other day with, I guess, a colleague of yours, another doctor. She came to enlighten us about cervical cancer, and she mentioned that that's the only cancer that kind of has sort of a specific cause and all of that. So, yeah, a vaccine as well for HPV. Speaking now about breast cancer, is there any new thing that's coming up, any development on how to treat cancer, or perhaps locates a specific cause that's on the way or that's ongoing at the moment?
I would say for therapy, for example, I keep saying HER2 because it's one of the newest breakthroughs we have. Previously, there was nothing for it, but now there's targeted therapy. So it's more expensive, but those who take that they stand a higher chance of beating breast cancer. We're still trying to get medications and other therapies for other ones, but for now, that one is really it's awesome. It's a win for women and for medicine everywhere, and men as well.
All right. So, any final words for the women out there, and also families, people surrounding these women, how they should also conduct themselves during these times, assuming, it happens?
Okay, assuming you're out there and you have breast cancer, or you have family member who has breast cancer, the first thing that they need, honestly, is reassurance. Sometimes it's all in the mind. Some people, they're so downtrodden that they don't have the energy to get up. You're there with them. It's a disease. It's not a death sentence. There are people who have gotten stage 4, stage 5, and they've come out strong and they're speaking about it. So assure them, and then give them words of support. Financial support, honestly, if we're in our society, financial support, if you have and you can aid this person, please do that. And another thing I would want to say is diet. Like every family, please exercise, start incorporating exercise, start living a healthy diet. It just starts with one person, and the other people can begin to follow or take an example as well. So
thank you so much, Dr. Nguper.
yes.
It's been a pleasure, and we really learned a lot. And I think we can all take this now and work with it. And also for the men as well, I think that are perceptible. You said 10%, 1%? 1%,
yes,
we also care
1%.
about you. So
Yes.
you can also take care of yourself. So thank you so much for breaking it down.
Thank you so much for having us.
All right. So that's it here. I've been having a conversation with the medical officer of Medicaid Cancer Foundation, talking about Dr. Nguper Dooyum-Laha. And she has broken down the issue of breast cancer. I do hope you've taken the important bits you need so that you can get the help you need, or even do preventive measures to ensure that you don't need the help at the end of the day. Thanks so much for joining us. Do join us once again on Untangle. I remain Amadine Ogbewe. Bye for now.